Picture this. It's 8 p.m., your child has a fever, and you're staring at the thermometer thinking, do I go to the ER? Should I wait for the doctor tomorrow? Or head to the urgent care? Every parent, partner, or caregiver has been there, tired, worried, and hoping not to make the wrong choice. Choosing the right place matters. Going to the wrong one could mean hours of waiting or a surprise bill that you didn't see coming. In this module, I'll show you a simple step-by-step way to figure out where to go when you're sick so you can get help fast, spend less, and feel confident about your decision. All right, for this agenda, we have the cost and time trade-off, when to choose the ER, when to choose urgent care, when to call your doctor or clinic, the 3-question test, common mistakes people make, real life practice, extra tools to help you decide, closing and next step. Before today, did you have any idea how different the costs are between the ER, urgent care, and the clinic for the same problem? When you're deciding where to go, do you usually think more about time or who can see me fastest or money? What will this cost? The cost and time trade off. Here's the truth, the same medical problem can cost 3 completely different amounts depending on where you go. The emergency room, ER, typically $1,700 to $2,700 on average before insurance. Urgent care, usually between $150 and $450 depending on location and whether you need an x-ray or lab. In doctor or clinic, about $100 to $150 without insurance or a $20 to $40 copay with coverage. It's the same country, sometimes even the same street, but wildly different price tags. Why? Each setting has different staff, equipment, and hours. Hospitals stay open 24/7 with surgeons, nurses, and specialists ready for anything, and that readiness is expensive. Clinics run on appointments with smaller teams, slower access, but cheaper visits. Now, here's an example. Brandon went to the ER for a sore throat at 10 p.m. The visit took 4 hours and the cost was nearly $1,900. His friend Kayla went to the urgent care the next day and she was in and out under an hour for $150. Now, did you know about 30% of ER visits could be handled in clinic or urgent care centers? That's millions of people paying emergency prices for non-emergency care every year. When you know these prices and time differences ahead of time, you can make quick, confident calls instead of guessing in the moment. When you hear ER, what comes to mind first? Expensive or life-saving? Could you list 2 or 3 symptoms right now that would make you say, no question, we're going straight to the ER? When to choose the ER? The emergency room is for life-threatening or very severe problems, the ones where minutes count. Go to the ER for chest pain, pressure, shortness of breath, heavy bleeding that won't stop, stroke symptoms, sudden numbness, confusion, trouble speaking, major injuries or bones sticking out, serious burns or head injuries, severe abdominal pain or vomiting blood, fainting or feeling like you might pass out, sudden vision loss or seizures. ERs have CT scans, surgical teams, and ICUs ready for anything, and that preparedness is what you pay for. Now, here's the scenario. Melissa was hit by a car while biking. The ER team stopped her bleeding, ordered scans, and found a broken rib. That's exactly what the ER is built for, fast, life-saving care. Now, did you know ERs handle roughly 30 million visits per year in the US, but fewer than 1 in 10 are true life threatening emergencies. If waiting could cause permanent harm, go to the ER. It's the right place, even if it costs more. If your doctor's office were closed and something couldn't wait, where would you usually go right now? ER by default, or would you think about urgent care? How clear does your line feel to you between urgent but not life threatening versus true emergency? When to choose urgent care? Urgent care sits in the middle for things that can't wait days but aren't life threatening. Use urgent care for fevers or illnesses that aren't improving, bad coughs, sore throats, or ear pain, sprains and minor fractures, rashes or mild allergic reactions, cuts that need stitches but aren't bleeding badly, nausea, vomiting, or mild dehydration. Most centers have basic labs, x rays, and evening and weekend hours and treat patients 6 months and older. Now, here's an example. Angela woke up Saturday with a sharp ear pain. Her doctor's office was closed, so she went to urgent care. They checked her ear, prescribed medication, and she was home in 30 minutes for $180. If the provider finds something serious, they'll send you to the ER, meaning two separate bills, but a potential lifesaver. Now, did you know there are over 12,000 urgent care centers in the US, more than the number of hospitals? Urgent care is your best backup when you can't wait for your doctor, but you don't need the ER. When you start feeling sick, is your first move usually to call your doctor, Google it, or just wait it out? How comfortable do you feel using your clinic's nurse line or portal for questions instead of going straight somewhere in person? When to call your doctor or clinic? Your doctor's office is the safest and cheapest place for routine or mild issues. They already know your history and medication. Call your doctor for checkups and follow ups, prescription refills, ongoing conditions like asthma or diabetes, minor infections that can wait a day or two, questions about lab results or treatment plans. Advantages: lower costs and a provider that knows your whole history. The downside: limited same day appointment. Ask about after hour help. Many clinics offer telehealth or an on call nurse line for evenings and weekends. Now, here's an example. Chris felt a sinus infection coming on. He called his clinic's nurse, booked a virtual visit that night, and got antibiotics delivered. No ER, no urgent care, just quick treatment. Now, did you know most insurance plans cover telehealth for common issues like colds, rashes, UTIs, often for $0 copay? Your regular clinic should always be your first call for non urgent care. They're your main partner for staying healthy long term. The last time you were unsure where to go, did you have a simple checklist in your head or did it feel like guessing? The 3 question test. When you're sick and unsure, ask these 3 questions. 1. Is it life threatening or could waiting be dangerous? Go to the ER. 2. Can it safely wait until tomorrow? Call your doctor or clinic. 3. Can't wait, but it's not life threatening. Head to the urgent care. Still unsure? Flip your insurance card over. Most have a 24/7 nurse hotline or telehealth number. Describe your symptoms and they'll guide you to the right place for free. Now, here's a pro tip: use your insurance app to find in network urgent care centers. Out of network visits can cost double. Save the nearest urgent care and ER address in your phone. Also, for parents, store your child's doctor and nurse line numbers in your contacts now. The goal isn't just to know your options, it's to have them ready before you need them. Look at your own habits. Which are you more likely to do? Overuse the ER or tough it out? Too long at home? Have you ever gotten a bill and thought, If I knew more, I would have gone somewhere else. Common mistakes people make. Even smart people fall into the same traps. Here's how to avoid them. 1. Going straight to the ER for minor problems. You'll pay ER prices and wait behind critical patients. Call the nurse line first. 2. Ignoring worsening problems. A wait and see approach can backfire, especially with chest pain or shortness of breath. 3. Forgetting to check network status. A 60-second search can save you hundreds of dollars. 4. Not knowing after hour options. Many clinics offer telehealth or weekend visits. Now, here's an example. Dana drove to the ER for pink eye, a $900 bill. Her clinic treated it the next morning for $80. One phone call could have saved her hundreds. Plan ahead and ask questions. That's how you avoid expensive mistakes. As you hear these scenarios, try to answer out loud in your head. Where would you actually go right now? Not just what sounds correct. Which types of situations still feel fuzzy or hard to decide? Real life practice. Test yourself with a few examples. Toddler has a 101 fever but is drinking fluids and playful. Clinic or urgent care would make sense. Cut won't stop bleeding after 10 minutes. ER would make sense. Nagging coughing for 3 weeks. Doctor's office or telehealth would make sense. Itchy hives but breathing is fine. Urgent care or telehealth would make sense. Dizziness plus confusion and weakness. Calling 911 or the ER would make sense. These are real world decisions families make every day, and practicing them makes perfect. Right now, if something happened tonight, do you know which urgent care or ER would you go to and how to get there? Do you have the nurse line, telehealth, or clinic numbers saved in your phone, or are they still on your card in a drawer? Extra tools to help you decide. Here are a few tools and tricks to make choosing easier. Save local nurse lines. Hospitals and insurers offer 24/7 advice numbers. Download your insurance app. Find in network urgent care instantly. Bookmark telehealth options. Set up your account before you need it. Know your closest ER and urgent care. Drive there once you remember the route. Now, did you know many employers and schools now partner with telehealth companies that offer free virtual visits? Check your benefits before paying out of pocket. After this module, what would you actually do this week? Save numbers, look up urgent care locations, or check your nurse line. How would it feel the next time someone gets sick to say, I know exactly where we're going and why? Closing and next module. Now you have a clear plan for what to do when illness hits. You've learned the cost and time differences, how to truly spot emergencies, and when to use urgent care or your doctor. You learned the cost and time differences, how to spot true emergencies, and when to use urgent care or your doctor. So next time it's 8 p.m. and when you're staring at a thermometer, you won't panic. You'll know exactly which door to walk through. In the next module, we'll talk about how to make those visits smoother, what to bring, how to prepare, and how to cut down on waiting times so every appointment feels easier. I will see you in the next module. Thanks for watching.